Welcome to all the bold, courageous, and powerful women tuning into Find Your Fabulous. I'm your host, Dr. Diane, and it's time to ignite your full power. Are you ready to embrace your talents and worth and unleash the wise goddess within? I've got the information, inspiration, and revelation you need to ignite your personal power so you can stop playing small and reclaim the passion and purpose that we all hold within us. Connect with other powerful spiritual women who yearn to be fully expressed. The world needs you. Full power. Let me guide you to find your fabulous and ignite your inner goddess. It all starts now on the Find Your Fabulous show. Hello, everyone. I'm Dr. Diane Garrison, and you are listening to Find Your Fabulous on Transformation Talk Radio. Stay with us for the next hour and let us help you experience the pathway to finding your fabulous. Join us every first and third Monday at 8 a.m. Pacific Time, 10 a.m. Central Time, where we will have information, inspiration, and revelation to help you ignite your personal power and reclaim the passion and purpose we all hold within us. I have with me today as my very special guest, Dr. Victoria Mondloch, a retired OB gynecologist and wellness physician, and of course, my beautiful producer, Emily. Good morning, ladies.
Good morning.
Good morning, and thank you for allowing me to be on the show with you today.
You're very welcome. I'm excited for this episode. In today's mind-blowing episode, Dr. Victoria Mondloch and I will explore the truth about menopause and how balancing your hormones can bring health and happiness, allowing you to become full bloom. But first, let me introduce you to Dr. Victoria. Dr. Victoria Mondloch is a retired OB-gynecologist and wellness MD with over 35 years in practice. She continues her mission of educating and empowering women and men in optimal health by balancing the 4 foundational hormone groups in the body, helping patients feel 15 to 20 years younger than their stated age. During her practice years, she specialized in women's health, family medicine, and preventive health and wellness with the goal to keep people out of the medical system and off medications as much as possible. Dr. Victoria is the author of 2 wonderful books, Blossoming, Becoming a Woman, a Mother-Daughter Guide, and Full Bloom, Perimenopause, Menopause, Postmenopause, and Beyond, Health and Happiness Through Hormone Balancing. She is also a married mother of 3 adult daughters, a girl mom like myself, and she happens to be also from my hometown, Waukesha, Wisconsin. In fact, this episode is dedicated to Dr. Victoria's daughter, Stephanie, whose birth date is today and who sadly left this world way too soon. Stephanie was also a healer, a Ph.D. in nutritional sciences, passionate about vegetables as medicine. She spearheaded a community garden program for kids to teach them how to grow the produce that their families would have bought at the stores and gave them recipes to help feed their families. She could never do enough for others and is truly missed by all who knew her. So thank you, Stephanie, for bringing your light into this world, if only for a short time. So, Dr. Victoria, I always start the interview by asking my guest, what does being full power mean to you, and how did you step into your personal power? And for me and you, how and why a traditionally trained doctor moved into the field of alternative medicine and wellness. How did you become so fascinated with hormones?
Well, it all started with my own personal journey, which at age 44, the kind of the middle of perimenopause, I woke up one morning with my face on fire and I couldn't open my eyes. And I suffer from rosacea, which is actually increased blood supply per square inch to your face. So you're much more prone to having a redness, but more importantly, it raises the skin temperature of your external skin, and it changes the bacterial mix that lives on your skin. So you're more prone to acne, and my type of rosacea was a cystic acne. And
Mm.
so I had kind of gotten to the point where I had managed to monitor it and keep it at bay, but never get over it. Perimenopause and hormone shift just exploded it. So when I got to the bathroom and had to pry my eyes open and saw my face, which was swollen and red, and I screamed because I had to be in the operating room, doing surgery that morning. So very long story short, I had an esthetician help me calm it down. I'm using ice packs all day to bring down the swelling. And I walked into my best friend office manager's office and I said, I don't know what's going on here. And she sat back and she crossed her arms and she said, well, doc, if you don't know what's going on, how do you expect your patients to know what's going on with them? Boom.
Mm.
That moment was actually the beginning of my quest to find out what happens in women's health. Why was I so blind to not even realize that hormone change is causing this? Why doesn't medicine see this? Why don't we check levels? And everything was the 2-year-old why? Why? The incessant why. And so I made it my mission to actually discover how to help myself so I could help my patients.
Yeah. Yeah. And that's fabulous because, well, I mean, you know yourself that women's health and researching women's particular health issues has never been kind of the top thing on the research platform. So it's so fantastic that someone like you took such a great interest in learning how our bodies work and how we can not only survive menopause, but actually become full bloom. I think that's truly, truly cool. And I love the work that you do.
Thank you. And it took leaving my group. I was president of an 8 physician group. I left the group because I had embarked on this mission of wellness with my group. And I found them sabotaging the actual programs that we put in place. I
Wow.
brought it to the entire group at a corporate meeting, and I said, I need to know who wants this wellness program for perimenopause, menopausal women, and who doesn't. And around this table of 8, 7 raised their hands. They didn't want the program. I said, well, what do you want? We want more surgeries. We need to make more money. And I said, I can't work with you. I took a piece of paper and I wrote, I quit, and I put it in the middle of the table and I walked out. And
Wow. You're
I
a
got home early
badass.
from that meeting, and my husband looked at me and he said, "You're home early." I said, "Yeah, I quit my job." He said, "You what?" I said, "I'll figure it out." So I went solo and never looked back.
Wow. That that's being full power. That's stepping into your personal power in a big way and kind of, saying no thank you to corporate medicine, which is really all about making money.
Well, right. And what do we go into medicine for? We take an oath to do no harm. We
Right.
also are supposed to be the everlasting scientist. We're supposed to be always pushing the envelope, asking questions, doing listening to the research, perhaps doing the research in what is going to make our patients' health better. Is that idea lost? Well, in women's health, it just appears that there's a lack of science in women's health. And it's no more apparent than where are hormone levels in the science of women's health. I
Yeah,
would have patients routinely walk into my office and they would say, I don't feel good. And
right.
you're the eighth doctor I've seen. You're the 12th doctor. I had one patient walk in. She said, you are the 18th doctor that I've seen. I don't even know why I'm here, but my friend said you can do something for me.
Mm,
And I said, you're in the right place. Because what has gone awry is that nobody checks hormone levels. Where when you start patients on a course of treatment, don't we usually do baseline labs, baseline studies, do the course of action, follow up on follow-up labs, follow-up studies? Don't we do anything scientific in other parts of medicine? Yes. If you're diabetic, we're incessantly checking a blood sugar, right?
right.
And yet there's no insulin that's being checked, which is the precursor hormone that goes awry before blood sugars go awry.
Yeah, it's
If we're
shocking.
going to have hormone shift, why don't we check female and male hormone levels? Why don't we understand? We simply say, oh, it's your change, or oh, it's perimenopause. And
And you
we,
just get to suffer.
yeah, we label it and they say, but you'll get through it. Well,
Mm,
wait a minute, what kind of science is that? There's no science to that. I want help. I'm having trouble sleeping. I have brain fog. My acid reflux is horrible. My bladder is leaking every time I go from sitting to standing. I'm more emotional all month. I'm bloated and constipated at the same time. And I'm losing hair from the top of my head. And you know what they say to you? Well, you must be depressed. Wait a minute, where in there did I say I was depressed? I'm seeking help. Don't depressed people usually not seek help for a while? You know, what in any of those symptoms did I just say to you said depression? Well, we're going to put you on this antidepressant. And you,
Right, right.
right? Well, okay, he's the doc, she's the doc, they know best. Well, guess what? It doesn't work. Wow. Surprise,
Wow, why?
surprise.
I got to tell
Yeah.
you, Dr. Victoria, my story. So, I was seeing a new female family practitioner. She couldn't have been but 35, maybe. And I came in with these complaints. And she said, well, sounds like you're in perimenopause and there's really nothing we can do about it. And I said, you're fired. And I left.
Good.
And I'm like, geez, you're fresh out of medical school, just in practice a couple years, and you're going to say that to me? And then someone sent me to an integrative doctor, and I got on bioidenticals, and life continued.
Right.
I
But
was so shocked. I'm like, you should have the greatest research. Oh, there is no greatest research.
and you said it, you hit the nail right on the head. Fresh out of medical school and no clue. Because
No clue. And a woman.
and realize what that says is that medical schools are financed and therefore basically run by pharmaceutical companies who have no interest in having biologically identical to what the body makes. They have no interest in keeping people as healthy on things they can't patent. They want to keep people under their thumb on medications they can patent, which are chemical. So
Right.
why would you put chemicals in a biologic system that runs head to toe like a beautiful symphony?
Mm,
Hundreds of pieces of working parts that all have to work together. why do we throw chemicals into that mix? It's
Very good
like,
question, and we're going to explore this next, but we have to go into a short break first. You're listening to Dr. Diane and the Find Your Fabulous show. We're going to take a quick break, and when we come back, Dr. Victoria and I will continue to unpack the truth about hormones and health. But before we break, Dr. Victoria, how can our listeners reach out to you and get their hands on your wonderful books?
well, thank you for that. My website is usually the best, which is actually Dr. Victoria J. Mondloch. And so if you just put the HTTPS, Dr. Victoria J. Mondloch, it'll take you right to my website with links to both my adolescent book and my perimenopause menopause book.
Beautiful. And we're also going to have on the podcast description after the show a PDF that will allow you to link directly to Amazon. So we're going to help you out too. And for all things fabulous, including my coaching services and free empowerment resources, you can check out my website at fullpowerwomen.com. Stay tuned. We'll be right back. Hello, everyone. We're back on Find Your Fabulous with Dr. Diane. My guest today is Dr. Victoria Mondloch, retired OB gynecologist and wellness physician who has specialized in educating women about the connection between their hormones and health. Dr. Victoria, perhaps we can start with a brief tutorial about how hormones work in our body and what changes typically happen in midlife with perimenopause and heading into menopause.
Sure. Well, everyone realizes that puberty is the start of quote unquote our womanhood. And with puberty, average age in the US, age 12 and a half, is when we literally kind of kickstart our femaleness, if you will, in our body. But what many people really have no idea, including doctors, is what is the age appropriate level for a 14-year-old, for an 18-year-old, for someone in their reproductive years of their 20s and 30s. What is age appropriate levels for a woman in her 40s, for a woman in her 50s? And is it safe for women to be on hormone after menopause? Well, those are great questions. And if you would say, well, show me the graph of where hormone levels should be in women, guess what? There is no graph.
Oh, no.
So I took that task upon myself. And I did, in the past 20 years of my practice, consented research on my patients, and I developed those graphs. And to be perfectly honest, I'll just ask you a quick question. If you were a 20-year-old female, would you want the hormone levels of a 44-year-old female? And
Heck
you'd go, uh, no, thank you. But yet nobody can tell you what those numbers are. You just know that you want to be what you need to be. But what is that? So medicine is really, really good at saying, okay, even if I draw your level, which they don't draw levels, but let's pretend for a minute you're in my practice and I'm going to draw your hormone levels. Well, what medicine will do is give you a reference range.
Right.
Well, guess what? That reference range is based on somebody from puberty to death. What? What?
Makes no
Um,
sense.
excuse me. So what they'll tell you is you're in range. It's no, yes, am a 20-year-old, but I don't want a 44-year-old level. So how do I make you, doctor, understand that I don't feel good? Well, what are some of the symptoms you're having? Well, okay, now we're getting somewhere. Symptoms. So, what are your symptoms? Oh, well, and I'll use the same list that I used, prior to the break. Oh, I've got brain fog. I'm having trouble sleeping. I have increased acid reflux, increased PMS all the time. I'm bloated, but yet constipated and losing my hair. Oh, well, you must be depressed. Or, oh, I'll send you to somebody about hair loss. I'll send you to somebody else about your acid reflux. I'll send you to somebody else for your brain fog. I'll send you so all of a sudden you've got 4 or 5 referrals that they're going to look at you and not understand this is hormonal. They're going to look for it as a disease in their
Right.
specialty and then want to prescribe a medication. Well, wait a minute. If it was something that is tied to hormone, the best question to ask is, why don't we check our hormone levels? Wow, doesn't that seem like a very simple and honest approach to bring to your doctor? Well, honestly, they're told you can't go there because you don't know how to interpret these levels because they
Mm,
were never taught in medical school. And if they work for a hospital system that is run by an insurance company or run by a corporate entity, they're told it's not profitable for you to go there. What? So you're literally, as a female, 50% of the population is aced out of knowing the science of how your body works. So let's take all of these symptoms, and they come out of my book, both books, but in particular, we'll talk about full
let me
bloom.
see if I can get that share that because I have it.
Oh, excellent.
Uh,
Because
oh, is this the share? Okay. Here you go, Dr. Victoria. Can you see? Yeah.
perfect. Yes. So that sheet, and it is listing many of these symptoms. This is a simple resource as a one-page sheet that you can see as the header at the top left, E deprivation symptoms. Well, E is estradiol. You notice the short-term memory, difficulty concentrating. You see the insomnia. You see migraines, heart palpitations, deep fatigue, muscle ache, joint ache. You see the increased reflux, the GERD, gastroesophageal reflux disease, heartburn, painful intercourse, urinary incontinence, which is your bladder leaking. Notice the bottom one, low libido, under estradiol deprivation symptoms. That doesn't mean you need testosterone, ladies. It means you need to know your estradiol levels and are they appropriate for you. Look at the P4, the next column. P4 is progesterone, the second female hormone. Look at those deprivation symptoms. The first 3 to 4 are PMS symptoms, right? Then you've got GI symptoms of bloating and excess gas, and you've got constipation in there, and you've also got breast tenderness,
Mm,
spotting, heavy periods, headaches. You've got very definite symptoms that a regular traditional doc will go, oh, well, I'll send you to gastroenterology. And what are they going to do? Scope you. Well, wait a minute. Can't we check my hormone levels? Oh, no, 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 no. We don't know how to do that. That's not important. We'll send you to GI. They'll get to the bottom of it. Well, they're just going to scope you and then say everything looks good.
right.
Well, wait a minute. If everything looks good, why do I feel so bad? Oh, I don't know. I'm going to send you back to your doctor. Well, that was a great big do loop where you spent, if you have a $10,000 deductible, you spent 5,000 on the scope from above, 5,000 on the scope from below, and you've got nothing to show for it. Nothing. So why what is your recourse? Well, in the books is this resource, what you see on the screen. You can actually use this resource, check your symptoms, bring it and a copy of the book to your doctor and say, I'm having issues. Notice 8 of my 10 checked are from the estrogen deprivation symptom list. Notice the other 2 are in the progesterone deprivation. I want my hormone levels checked. And if they can't do it for them, then take Dr. Diane's advice and fire your doctor and find somebody who will do it for you. because you
about that.
need to know.
And so the symptoms on the bottom, excess testosterone, that's what happens if we are very depleted in our estrogen and progesterone. This is the other thing that can happen to us.
Well, it happens in menopause. We actually become male.
Uh,
What? We become male. Our female hormone essentially goes through a bell curve. It's a lot more complicated than that, but if you average what the curves look like, it's a bell curve. But then in menopause, our ovaries stop making female hormone, but they continue making male hormone. Now,
oh, so
male
I
hormone,
have
if
the
you,
tire around my middle.
yep, look at the second from the bottom under excess testosterone. What does that say? Mid-abdominal weight gain.
Just like all guys get, right?
Right, the Milwaukee tumor, we used to nickname it. So if indeed you put 5, 8, 10 pounds around your abdomen and you haven't changed a thing, in fact, you've decreased and improved your dietary, you've decreased the calories, you've increased your exercise, and you're still putting mid-abdominal weight gain on. Guess what? It's not your fault. It's hormones doing this to you. So we become male, chemically speaking, in menopause. So why are doctors giving us more testosterone, calling it help for our low libido? Well,
Uh,
no, 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 no. So that's what happens in menopause, but there is a condition in the reproductive years where women will, and it's genetic, where women will intermittently be female, intermittently be male. So
wow.
if female hormone is doing this, sometimes, and this is male, sometimes you're more female, sometimes you're more male. Well, how schizophrenic is that,
Yeah. Well,
right?
that sounds like a topic for a whole new podcast.
Well, it is, and it actually is polycystic ovary, which again,
Ah,
doctors
okay.
don't know how to check for it
Check
because
for a
it's
treat.
checking for hormone levels.
Right.
So, but who wants to be a male when we're
Not me.
female? Who wants to have that extra 5 to 10 pounds around their
Ugh,
abdomen when we worked our entire life to keep that off? Who
yes,
wants to buy a new wardrobe to go to work? No,
exactly.
absolutely not.
Dr. Victoria, we need to head into another break and we are going to continue this juicy conversation afterwards. We've got more to unpack. Before we go on break again, Dr. Victoria, tell listeners how they can reach out to you and get their hands on your wonderful books.
Well, my books are on my website. The link to the books is direct to Amazon for Kindle or for print. But my website is the https drvictoriajmonloch.com. So my name, drvictoriajmonloch.com.
And we will also have a PDF on the podcast description replay page that has the checklist so that you can take a quick survey of your own symptoms. And for all things fabulous, including my coaching services and free empowerment resources, you can check out my website at fullpowerwomen.com. We need to head in for a short break, but we'll see you back soon. Hello, we're back on Find Your Fabulous with Dr. Diane. And my guest today is Dr. Victoria Mondloch, retired OB-gynecologist and wellness doctor who has specialized in educating women about the connection between their hormones and health. Okay, Dr. Victoria, so a woman has taken your little checklist and is pretty sure her hormones are imbalanced, out of whack. Tell us, how does she find, if she goes to her doctor, you recommended taking the checklist and the book to her physician, but if her physician says, well, I can't help you with this, Tell her how she does find a physician willing to help her and what she can expect from treatment.
And that's a great question because so many women will go, as I mentioned, to the eighth doctor, the 12th doctor, the 18th doctor, and they're not finding the help they need. Well, what women have to realize is there are distinctions between the healthcare providers they're looking for. In
Mm-hmm.
in today's day and age, 77% of all physicians are actually employed physicians where they do not make the policy of how they practice. Their employer does, their corporate health does, their owner who runs their system and writes their paycheck. And so they're told you can't go there because that doesn't generate enough referrals to other specialists and you have quotas to keep. So I'm going to suggest first and foremost, find an independent physician who works the way the old model Dr. Marcus Welby worked, where you could sit down and you could actually have an honest conversation with that doc, and the doc, if he didn't know the answer, would research the answer instead of send you off to a specialist. That's number one. If you don't have the ability to find someone who's independent in your area, I'm going to suggest that you actually look for an integrative physician. They're going to be more trained on how to integrate the body's systems. So they already are much more attuned to the European research as well as the American research. Because believe it or not, in women's hormonal research about menopause, the American research came up with opposite results versus the European research. Mind blowing. How could you have opposite results when you're studying the same thing? But it did. The third thing that I'll bring up, and Dr. Diane, I know you're a component of this, is check with a compounding pharmacy. Now, pharmacies who compound are working with formulas that have been approved, but they're making it right at the pharmacy. And it may be other than an oral pill you take, it may be a troche, something you put under your tongue and it dissolves. It may be a cream that will be applied to your arms. It may be something that's vaginal that is either a gel or a cream. Some people will even make suppositories and use them, although that's variable based on how your GI tract is working in absorption. So realize that compounding pharmacies can also be retail pharmacies. They can do both in the same. Find out in your community and then check with the pharmacist as to whom are the compounding physicians and practitioners that
Right.
phone scripts in. And they will be hopefully a more listening type of caregiver for you. If you still have difficulty, then contact me and go through my website and get a hold of me, and I'll be happy to try and help find someone for you. But it's not an easy task because they do not teach this in medical schools. And you would think they would, but they don't.
Yeah, I mean, I get my hormones that I have for over 10 years now from a compounding pharmacy. And they actually do have a list of physicians that they work with. So I take creams and the sublingual stuff. But
Mhm.
I know some people have pills and gels as well. And so they're the ones who know who the doctors in the area willing to do bioidenticals are. So that's a great place, to start. And because it might be a little more than just a Google search, or you do a Google search and you're not finding an integrative physician and or alternative health women's physician. The terms can be tricky, but those compounding pharmacies know who they work with because that's their bread and butter. So,
Right,
so
right.
that's a really easy way to, you know, uh, get some numbers, and then you can go on Google and look at their profiles and see what if these people feel attractive. So,
Right. And I'm going to just put a plug out there for make sure that once you get started on a program, your work isn't done, just like their work isn't done. In other words, you need to, like any medication, follow the trend. What are your symptoms doing? What are your blood levels doing? Because women are not counseled in the fact that if you don't have proper balance in your female hormones and you are still, you might be put on hormone, female hormone, but you still may be more male than female. Well,
Right.
that doesn't work for a lot of people, so they continue to have symptoms. And if they're checked by salivary levels, those levels are very, very different than blood levels. And all of the European research, which supports bioidentical hormone replacement, is done with blood levels. Most of the American research wanted to actually break ship and do a different precedent and do salivary testing,
Mhm.
but they're not comparable. And
Right.
when people would say to me, why don't you do salivary? I would say to them, let me ask you a simple question. Do you have saliva in your brain? Do you know how well that's going to work for your brain fog or your poor concentration? Do you have saliva in your muscle? Is that going to tell you why you have muscle aches and pains? Do you have saliva in your heart for your heart palpitations? No, you have blood in all of those places. So why don't we check the blood levels, which is going to be delivering the hormone, because that's really what your ovary does, is it puts it into your bloodstream. Wow, what a concept. We're going to do it the way the body did it and check it the way the body wants us to know about it. But the other caveat is that women in menopause, if you don't have an estradiol level of 30, when 100th percentile is 300, ooh, 30, then you cannot absorb calcium from your GI tract, and you are putting yourself at higher and higher risk of thinning bone loss, not just of your bones, but of your jaw, your teeth.
Right.
So osteopenia, osteoporosis, tooth decay, tooth bone loss, that you're losing good teeth because of bone loss in your jaw. And it is something that you may not see for 10, 15, 20 years. And all of a sudden, I had one woman who walked in. She said, I have to have every tooth in my mouth pulled and get a
Oh, no.
$40,000 full mouth implant done. This is crazy. I've done everything right. What happened? I said, are you on bioidentical hormone? Well, no. I said, well, that unfortunately is why you are losing your teeth.
So let me do a review before we have to head off for a break. Okay, so they read your book, take the checklist, feel like, yep, I have many of these symptoms. They contact the local compounding pharmacy if they don't know or don't have a girlfriend who's getting on bioidenticals. They get a list of names of physicians. They find someone they can work with. They go to the physician. The physician does some pretty elaborate blood work. I know because I get it regularly. And then you start on some hormones. There might need to be some tweaking,
Mhm.
and there will be retesting because your needs will change over time. But you should see some softening of all those symptoms that are on your checklist. And with estrogen in your system, that's also, and progesterone, it's protecting us from osteoporosis and osteopenia, which I'm not quite sure what that is, but I heard that word. So this is, we can get our life back, although we won't look like we did when we were 30.
Mhm.
We can have some sleep, we can have normal urinary retention, we can have good mood and energy again, and our brain working most of the time, and feel like we are navigating this next chapter of life with a lot more grace and confidence.
Right. And realize that properly balanced hormones actually is preventive for breast cancer, preventive for uterine cancer, preventive for ovarian cancer, preventive for the osteopenia, early loss versus osteoporosis, full loss, and preventive for Alzheimer's.
Wow. And all we've been hearing is, oh, if you take estrogen, you could get breast cancer.
Far from, it's protective.
Right. Absolutely. All right. You are listening to Dr. Diane and the Find Your Fabulous show. We're going to take another quick break. And when we come back, Dr. Victoria and I will continue to unpack the truth about hormones and health. Once again, Dr. Victoria, tell our listeners your website so that they can get a hold of you.
It is drvictoriajmonloch.com.
And
So,
Mondloch is Mondo, because I kept on spelling it with an A and it didn't work. OCH.
Mondloch, correct.
All right. And to learn about my coaching services and free empowerment resources, check out my website at fullpowerwomen.com. And if you missed any information on this show or any other and you want to catch the replay, you can also access those from my website as well as my YouTube channel, Full Power Women. And if you want to talk more, just email me at drdiane@fullpowerwoman.com. And we're going to go for a short break and we'll be right back for our last juicy section of the show. We're back on the Find Your Fabulous show with Dr. Diane and my guest, Dr. Victoria Mondloch, retired OB gynecologist and wellness doctor who has specialized in educating women about the connection between their hormones and health. And Dr. Victoria, we were just starting to unpack how using bioidentical hormones can actually be preventative of a lot of other scary disorders.
Right. And in fact, it's the opposite based on European research of what American research shows is that bioidentical hormones, especially balanced properly, is actually going to cause a decrease in breast cancer, a decrease in heart attack, a decrease in stroke. And what we also know is that you get a decrease in reversal of bone loss, osteoporosis, and you get a decreased incidence and reversal of Alzheimer's. And you go, wait a minute, why is that so? Well, if you think about it, we live as many years with female hormone, puberty to age 50, that's 38 years, as we then do from age 50 to about age 90, if we live that long. We live as many years without hormone. Well, wait a minute, why does this happen? Well, we've allowed medicine to give us breakthroughs in cardiac medicine. We can stent a blocked vessel. We can do bypass surgery. We have medications that we can give to reverse the devastations of a stroke. But yet women go through menopause and we go, oh, well, that's just Mother Nature saying you have to quit. Well, realize in 1912, the average age of the American woman was 48 and a half years old.
Right.
Wow. And know that menopause didn't exist. So if we can improve in all of these other areas of health, why don't we even study women's health? Why don't we even check levels? Why don't we even help women keep their moxie, if you will? You know, that's our lifeblood. Men never lose their testosterone. At age 100, they're still making 20%. Their graph is a completely different graph of hormone degradation than ours, which goes like this, and it just drops off, but keeps making male. So it's not the same. Women, we need to take our power. We need to tell our docs we want our levels checked, and we're not going to just take the idea of you're there, there's nothing I can do about it. I cry foul and say, let's keep our mind about us, prevent Alzheimer's. Let's keep our bones about us. Who wants to take a bad step off a curb and suddenly you've got a hip fracture, which may be the beginning of a spiral that now you lose your independence and your mobility. But realize too that your female male hormones are one leg of a four-legged hormone chair. What do I mean by that? There are four foundational hormone groups that literally control the baseline of your optimal health. So your female male hormones is one leg. Your thyroid, another set of hormones, is very important, and stress on one can put stress on the other. The third leg of that chair is another hormone, cortisol, your stress hormone. Well, who gets stressed, right? Well, we all do, whether it's financial or physical or emotional, it's stress. And it has the same effects, and it can impact your female male, it can impact your thyroid. But the fourth leg is your insulin.
Mm,
Nobody ever checks insulin. They will check a blood sugar or an A1C, but not the all important hormone insulin. So again, they all talk to each other. They all have an effect on each other. And if one is stressed, the others are stressed trying to help out. And let me ask the very simple question. If you sit on a chair with a broken leg, what happens? Boom, you're on the floor and you don't even know how you got there.
right.
You rewrite the chair and you sit on the same broken chair. And you're told, oh, everything is fine in your blood work. Well, they don't check those labs. So they're telling you to continue sitting on that broken chair. Well, isn't that the definition of insanity? You do the same thing expecting a different result.
Right. Yep.
So,
Absolutely. The
right.
definition of insanity. So, right. So it's important that we have physicians that check all our hormones. And I know mine does, but she's very integrative. Um, and again, it's searching for that physician who's really going to not worry about what the next quota, but who is really going to be focused on our health holistically. And speaking of holistic, I know you spend a good bit of time in your book also on the foundational pieces of nutrition and exercise as part of a whole health and wellness regime. Can you
Of
want to say a
course.
little bit about that?
Right. And again, that ties back to the insulin and blood sugar. But if you're eating properly, and not everyone that will eat a paleo diet will feel good, because genetically we are meant to eat the way our body's genetics wants us to eat. And
Mm,
there is testing that you can do via cheek swab to tell you whether or not you're best and going to maintain or lose weight if you do paleo versus keto versus Mediterranean, and how you should best exercise. So, diet is one thing. Knowing that intermittent fasting can, on a regular basis, be actually not good for you. Now, why do
mm.
I say that? That's a fad
Uh-oh.
these days. And you go, well, everybody's doing it. Well, does that mean it's right if everybody's doing it? Understand the science and understand that the body, when it goes more than 12 hours without any dietary influence, your body, your brain needs sugar to work off of. Okay. So, where does the body get sugar from if you're not eating after a 12-hour window? Well, guess what? Newsflash. It steals it from your muscles. So
Oh,
you work hard to build your muscles, and then you go more than 12 hours without eating, and now you break down the very muscle you just sweated at the gym to build. So
that makes no sense.
that's like a hamster wheel. You're
So, in
going
other
around and
words,
around.
since we are way running out of time, people need to get your book and read your book so they can understand how to better take care of themselves rather than the fads we on social media and TikTok and everything else. Get this book, learn more, advocate for yourself so that you can be your best, most full bloom woman. So, Victoria, before we end, how can our listeners reach out to you again? Give us your website one more time.
Dr. Victoria J. Mondloch, and that's Mondloch. Again, Dr. Victoria J. Mondloch, Full Bloom, the perimenopause, menopause, postmenopause book, is on the website, as is my adolescent book. You can click the cover, it takes you right to Amazon. There's much more information on there as well, but please, 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 educate yourself, learn how you can be your best
advocate. Absolutely. And we will have resources on the podcast description page as well. So, to learn more about my coaching services and free empowerment resources, check out my website at fullpowerwomen.com, and you can reach out to me directly at Dr. Diane at fullpowerwomen.com. I want to thank my very special guest, Dr. Victoria, for sharing such great information with us. And I want to thank all of you for tuning in to the Find Your Fabulous show. I had a wonderful time. Please join me every first and third Monday of the month at 8 a.m. Pacific time and 10 a.m. Central time, 11 a.m. Eastern time. Have a beautiful day, and I'll see you back next time on December 2nd, where we're going to explore both the psychological and spiritual implications of our election results and how to keep ourselves grounded and calm. All right, until next time, go out and find your fabulous, because you deserve no less. Bye-bye now. I'm your host, Dr. Diane, and you have been listening. You're fabulous. It's time to ignite your full power. Tune in every first and third Monday of the month at 8 a.m. Pacific time on Transformation Talk Radio for information, inspiration, and revelation to ignite your personal power. Connect with other bold, courageous, and powerful women who are ready to stop playing small and reclaim the passion and purpose that we all hold within us. The world needs you, full power. To find your fabulous and ignite your inner goddess, visit fullpowerwomen.com.